that's kind of needed at the moment of crisis, but
Right.
how we have to shift gears, which is, I think, the significant hard part, to move from this medical model, which is important in a crisis situation, moving
Right.
to the recovery model, which is when do you downshift and when do you relinquish control, when you don't want them to hurt themselves, you don't want them to hurt other people, but how do you know when to change gears, right? I mean, when they get to you, they're in recovery model, ready for it. But
Right.
the idea of putting it in inpatient, like Susan says, when do you downshift? You know, I mean, I think that's the biggest concern for me as a nurse. Like, when do I change gears? You know,
Change gears.
from I'm trying to control your life to protect you to now I have to relinquish control so that you can have more power in your life to.
Right.
Right? Like, that's the hard part for, I think, a lot of people in the hospital to go, I'm
Right.
here to protect you, I'm here to save, help you, and then when do I back off? And how do I back off in a way where it's safe and it's, you know.
Right. Right.
Don't you think it's always about sort of keeping the recovery model? I totally understand and respect exactly what you're saying, but just always keeping that model sort of in your minds at the same time, right? Even as you're sort of being the like, I'm here to keep you safe, but sort of in the back of your mind having it be a scale, right? Where there's still like the recovery model that's included as part of the package. Does that make sense?
No, I mean, I know where you're coming from. I guess it's, what I'm saying is it requires this high level of judgment to go from, containing and giving medication against people's wills to downshifting to try and make it more voluntary until you get to the point where you're like helping them gain their own control over themselves. And like relinquishing control is that hard part, I think, is the...
Right. And it's hard when someone's in crisis to like have a collaboration of like, here's your options, here's the symptoms, when someone's, actively psychotic and not in a place to make an informed choice for themselves. So I get that. I hear your frustration. Yes.
Thinking about what you said earlier and what you're saying in the model, we have a whole lot of people here that are here for 5 or 6 days, but we have a whole lot of people here that are here for weeks and sometimes months, and unfortunately a couple of people that are here for a much longer period right now due to system frustrations. And we have to, we can maybe have an easier time or a more successful time with helping the people that are here for that longer period of time rather than the 4 or 5 days, with really sort of reframing and helping them in the ways that you're describing it. But we all get so frustrated with the system and
Right.
with the bureaucracies that we sometimes kind of almost lose hope for the patient, not the person, but the person within the system that is just making it difficult for them to even succeed to get out of here.
Yes.
I just wanted to speak to that as well. I know that like from part of my recovery practice with patients is that if I'm ever making a decision for a patient that they're in disagreement with, I always attempt to articulate that very clearly and say, I'm in this position as a mental health provider right now, and this is what I'm deciding about this situation, and I recognize that you are not of the same opinion than me, and it's possible that you're right and I am totally wrong, but right now I'm in the position to make this decision, and going forward, as you start to get better and are given more of your rights back to do this, you are welcome to explore your own decisions about this, and hopefully that would work out well for you. And try to acknowledge the power dynamic that's there, and acknowledge that the difference of opinion has the possibility, at least, of being a valid difference of opinion. And I don't know, that's something that I do as well.
Well, I don't know if this is incorporated in the recovery movement. I was thinking as you're talking about the power dynamics, the ways that traditional, when it's not working very well, the medical model sort of plays into that. Basically, it makes doctors dictatorial and patients passive aggressive, which is part of the reason that AA was set up in the way that it was, because patients were saying, yes, doctor, you're perfectly right, I shouldn't be drinking anymore, and get out and drink at the bar. And peer-to-peer communications proved to be much more kind of effective. So I wonder if, in effect, the serenity prayer, everybody knows the serenity prayer, right? About figuring out what things you need to change, what things you need to accept, the wisdom to know the difference, is really core to kind of our dilemmas in this sort of way. That you're not, Harmony made it clear over there. She's telling the patient, I'm going to take responsibility for this situation, but it's not because I have all the answers. You may have the answers too.
Right.
That's right.
Questions?
Oh, before I end, fortunately I didn't bring enough for the whole class. If you're interested, I have a fact sheet with recovery tools. There's websites, things like Mary Ellen Copeland's Wellness Recovery Action Plan, lots of articles on recovery. So please pick one up if you're interested.
I have copies of the scripts assessment too.
Oh, good.
Yeah, if anybody wants those from me, I have them in my office.
Okay.
Thank you so much.
Thank you. Oh.
Thank you so much. This was wonderfully done and a big help. Please don't forget to fill out your evaluation piece.
Wait, I didn't know that it was you who was presenting.
Yeah. How was it?
I know I need it so bad here. You don't even know.
Yeah.
See? Yeah.
Yeah. Thank you. And your points were spot on.
Good.
So thank you for that.
Good.
Yes. I hate standing up there.
Oh,
You do it very well.
Thank you.
Good. I'm Miley. I'm a director of social work, and we're being asked to do some more groups. I was wondering, would it be possible for me to come and visit some of your groups to try to learn how you guys do them? We're trying to model ours.
Yeah.
Get more recovery based sometime, like come and hang out with you or something.
Yeah. I think I have a card on me today.
Okay, yeah. If not, I can just.